There's a difference between episodic dry eye, meaning it happens here and there every blue moon. There's a certain episode that will make your eyes dry versus you tiptoeing over to dry eye disease. So typically I teach my patients that in the event you have a particular day, particular time of the year, particular time of the week that your eye feels dry, gritty, and irritated, I encourage them to keep artificial tears on hand, particularly an artificial tear with no preservatives, and to hydrate that surface. It's no different than what you would do is if your lips are dry, your eyebrows or skin or feet are dry, you're going to moisturize it. But in the event you try that a couple of times, and those things don't seem to improve, then usually you will follow it with the respective specialist. So the eye is no different. So I usually say give it about 72 hours to a week at the most. If you can pinpoint it to traveling, pinpoint it to maybe being around a pet or a pet dander, something that you have been exposed to before, pinpoint it to a specific medication that you may have started that, using a tear here and there doesn't seem to help, then you want to come on in. Episodic dry eye should be exactly what it sounds. One episode here or there for that particular reason, that particular day, your eye was dry. You were able to use an artificial tear with no preservatives within about a 24-hour to 48-hour time frame, and it cleared up and you never had the problem again. If your episodic dry eye is every week, multiple times a week, maybe the top of the week, then you may want to come in and dig. We want to make sure that your oil glands are functioning. There's a couple of structures that are contributors to keeping your eyes moisturized. The oil glands, which are your meibomian glands, we want to make sure they're not clogged, which we know over time they can. We do want to make sure you are producing enough basal tear secretion. So there's ways that we can test for those things. So typically, if it's something that's happening regularly or consistently, follow up with the eye care professional, specifically one that may specialize in dry eye or ocular surface disease. But if it's something that happens maybe once a year or once every 6-7 months, then just treat that episode with an artificial tears, what I usually recommend with no preservatives, and then just kind of monitor, keep a mental journal, just to make sure it's not happening as frequent as you think it may be.